from Louisiana's home team. This is Fox 8 News at noon.
The Jefferson Parish coroner urges people to get a flu shot after the first reported surge of influenza in the parish. Dr. Jerry Satanovich, JP Coroner and Chief Medical Officer for MHM Urgent Care, is joining us now to talk about it. And do we normally see it this early, where we're actually seeing a little bit of a peak?
We saw it early last year, and it looks like we're starting to see it early again this year.
And why is that? What's the cause?
Well, typically the flu, starts in November, December, peaks in January, February. It peaks here in Louisiana later than most places. But last year we had an early surge where it started in October and peaked in November, December, and it looks like we might be on that same track this year.
Okay, who out there needs to really think about getting the flu shot this season?
Very young, the very old, people who are immunocompromised for any reason, whether it's from chronic illness or HIV or chemotherapy, and also very important, anybody who's pregnant or planning to get pregnant. It's vitally important for them to get vaccinated.
And what about people if you care for somebody who's really young or really old?
Exactly, because children under 6 months can't get the flu shot. So if you're a caregiver for somebody that's under 6 months or somebody in one of those categories I just mentioned, for their sake, you absolutely need to get yourself vaccinated to decrease the chances of you getting the flu.
I know last season I heard people say, well, I've never had the flu until this year, got the flu shot, then got the flu. I know that is a myth, but how does the flu shot protect you against it?
Trust me, it is a myth. Some people will get an upper respiratory infection after getting a flu shot. That is not the flu.
When you have the flu.
When you have the flu, you will know it and you will get vaccinated from that point on.
And once you get the flu shot, even if you do end up getting the flu, I mean, that happened to me last season. What are your chances? The risk, I guess, it kind of decreases the risk or the problems associated?
It decreases the risk. Look, every year in the United States, somewhere between 20 and 40,000 people are going to die from the flu complications. So, what getting the shot does is it'll decrease the likelihood of you getting it by 60 or 70%, but also if you do get it, your symptoms will be less severe and not last as long.
Okay. And as far as the strains it protects you against, are we talking about the same type of vaccine we saw last season?
Yes, most vaccines have 3 strains, the H1N1, which is influenza A, another influenza A, which is H3N2, and then a influenza B. So it's a trivalent vaccine that most people are getting.
And in the past, we heard people who were allergic to eggs, they could not get the flu shot. How has that changed this year?
That has changed. In the past, if you had eggs, they certainly needed to be more cautious about giving you a flu shot and observe you afterwards. But now, this year, there will be a vaccine available called FluLaval for people between the ages of 15 and 49 who have egg allergies. And most old flu shots were made in eggs. They grow in eggs. The FluLaval's grown in caterpillars, believe it or not.
Oh gosh. Yeah. You learn something new every day, right?
Absolutely.
But that's supposed to be, that actual flu shot should be coming out later this month?
Yes, later this month. We're going to have it at our MHM centers. I would encourage people who are interested in that, who have an egg vaccine allergy, to contact their provider about whether or not they're going to have it or where they can get it.
All right, still not too late to get a flu shot if you're concerned this season.
It's early, it's time.
All right, Dr. Jerry Satanovich, thanks so much for joining us and filling in for us.